Welcome back, everyone. Today we're going to talk about a very important topic, first aid. Accidents can happen anytime, anywhere, and to anyone. That's why it's crucial to understand the basics of first aid. How can you tell if someone needs first aid? What are the things you should look for? Well, you're in the right place. In this video, we're going to guide you through the signs that indicate someone needs first aid. Number 1. Introduction. First things first, let's talk about what first aid is and why it's important. First aid is the immediate care given to a person who has been injured or suddenly taken ill, before the arrival of professional medical help. It's all about preserving life, preventing the condition from worsening, and promoting recovery. Knowing how to recognize when someone needs first aid can mean the difference between life and death. So, let's dive into the signs you need to look out for. Number 2. Unconsciousness or altered mental state. One of the clearest signs that someone needs immediate first aid is an altered state of consciousness or unconsciousness. If a person is not responding to verbal commands, sounds, or touch, they need immediate medical attention. The causes of unconsciousness can be many, including head injury, severe blood loss, stroke, drug overdose, or a heart attack. In such a situation, the affected person needs professional medical help as soon as possible. Number 3. Breathing difficulties. Many injuries, illnesses, or medical conditions can cause breathing difficulties. It's a clear sign that someone needs first aid immediately. If someone experiences shortness of breath, wheezing, gasping, or choking, it's important to act fast. Breathing difficulties could be caused by various conditions, such as asthma, heart attacks, allergic reactions, or trauma to the lungs. In such cases, call for an ambulance or take the person to the nearest medical facility. Number 4. Excessive bleeding. Severe bleeding is a clear sign that someone needs medical attention without delay. The causes of bleeding can be many, such as deep cuts, lacerations, bruises, or internal injury. If someone is bleeding heavily and the flow does not stop even after applying firm pressure, they should be taken to an emergency medical facility. In the meantime, take steps to stop or control the bleeding using a clean cloth, bandage, or tourniquet. Number 5. Chest pain or pressure. Chest pain or pressure is a common symptom of many medical emergencies, such as heart attack, angina, or pulmonary embolism. If someone experiences chest pain that lasts for several minutes or comes and goes, it's important to act quickly. The person needs medical help immediately. While waiting for help, the person should sit down and rest, loosen tight clothing, and avoid any physical activity. That's it for today's video, folks. We hope you learned something new and valuable.